Let me bring up a good friend. And when it comes to medical minds, he's the best. Dr. Steve Hotze from Hotze Health and Wellness Center. Welcome back, Dr. Hotze. How you doing?
I'm doing great, Sam. Great to be back.
Good to have you on. Good to have you on. Medically, gosh, you and I could sit and chat every day of every week about the medical issues going on. We have to talk about one day migraines. Got to talk about thyroids one day. I mean, there's
a ton. We have a ton to talk about, but you know what we ought to talk about, which is plaguing a host of Houstonians today and for the rest of the month till the first freeze, is allergies.
Oh yeah, I get that. Like I'll get that drippiness all of a sudden where you're
what allergy is an abnormal reaction by your body's immune system to normal occurring substances in the environment. It's the things you breathe in the air. Right now we're in what is called weed pollen season. You can't see it. It's floating in the air, and most people think of it as ragweed, but there are literally scores of different weeds that are pollinating. And as a matter of fact, it floats in the air for hundreds of miles. So when the first real front came through in October, that brought down ragweed pollen all the way from Kansas, 400 and 500 miles. It floated into the Houston area, and that caused people to get the drainage and the congestion and the itchy eyes and the runny nose. And then people that have had allergies for a number of years that get the chronic drainage, it's a culture media for bacteria. The next thing you know, they got sinus infections, they got bronchitis, they got wheezing, they got asthma, they got a host of health problems, and it can be debilitating. And then, of course, when they get all the infections, they take antibiotics, and that causes a host of additional problems. In women, it can cause yeast problems, in men too, in the gut. And so allergies can be debilitating, and they really do. They cost people individually in their health, in their work productivity. It's a huge problem, and this is the worst time of year right now because the weeds are pollinating in Houston.
So Dr. Steve Hotze joining us from Hotze Health and Wellness. So it's like a chain reaction. You get the little drip, and then all kinds of things. You can get a sinus infection, then you take like antibiotics to fight it, and then your body's getting hammered on the antibiotics.
And then you get yeast overgrowth, then you get gut problems, you get bloating, belching gas, and it's a huge problem. And so what most people do, they go to the doc maybe, and the doc will give them maybe a shot of dexamethasone or some steroid shot to relieve the inflammation, which masks the symptoms, and it helps them over a period of time. But if they have sinus infections recurrently, and there are people that have those 2, 3, 4 times a year, next thing you know, they have polyps, and they got all kinds of problems. They end up going to their ear, nose, and throat surgeon. They get surgery. They get sinus surgery, and you see that, and that's a disaster. I never recommend going in to get that when you can treat the underlying problem by eliminating the allergies naturally, and that's not with drugs. Now, there's 2 ways you can really three treatments, 4 ways you can go with allergy. You can do nothing and suffer. And there are plenty of people who do that. There's no reason to do that.
Do nothing and suffer.
You can take drugs. You can take the antihistamines over the counter, get a prescription. You can take steroids that you can spray into your nose. You can take oral steroids that'll help mask the problems. If it gets bad enough, you may need sinus surgery. Or you can treat the allergies through immunization process, and that's allergy treatment. Most people, Sam, think of allergy treatment as going in and taking a shot. I don't know. Did you ever do that when you were growing up?
When I was a little boy, I went to the allergist, and I got the lump on my arm.
Right.
Oh, that hurt.
Well, that's historically the method of treatment. This sounds really strange. How do we treat allergies? You give people a dose of the very substances they're allergic to, but in small doses that allows their immune system to build up a blocking antibody to block that allergy reaction. Now, here's what happens. When you have allergies, your body is making antibodies to the very substances that are normal occurring in the environment. It's as if they were a bacteria, let's say, or a virus. Your body literally reacts to the pollens, whether it's weed pollens, tree pollens, grass pollens, dust mites, mold spores, which are year-round, animal danders. Your body is reacting to that in the immune system and forming antibodies that float around, and they bind to cells that line our mucous membranes in the nose and in the lung. In the mucous membranes are mast cells, and they're part of the immune system. And when when the antibodies glom onto the mast cells from the allergies, the mast cells rupture and spill a substance called histamine. You ever heard that term before, histamine? Well, you've heard of antihistamine. And the antihistamine is supposed to block the histamine your body's releasing from the allergy reaction. And that histamine causes swelling in the tissues. That's why you get the congestion. It can cause brain fog. It can cause the migraine headaches.
Wow.
It can cause stomach problems. And on top of the airborne allergens, you got food allergies that concomitantly or at the same time add to the allergy load. So you want to get the allergy load off your system. Think of it as a donkey. You weigh down a donkey with a bunch of bags, and he's going to collapse, right? What's the old adage? The straw that broke the camel's back.
Right.
Well, as these allergies build up in your system, they overflow, and you get these host of symptoms. So the way to treat it is to identify the allergens to which you're allergic, and at Hotze Health and Wellness Center, instead of giving shots, which we used to give routinely back in the 90s, we use sublingual drops. That's literally drops of the allergens under the tongue, just as you do. Think of it as it's an immunization like polio. You know, when you go get your polio with your kid.
So you do a test, you find out what you're allergic to, like I guess hay fever or grass or something like that, and then you're slowly giving these little tiny drops under the tongue.
And you take those on a daily basis, so you don't have to drive to the doctor's office and wait and get a shot and wait for 30 minutes or an hour and make sure, so you've got, a 2-hour process of going to get your allergy shots. You just take the drops in the safety of your home, and there's no problem. You don't have the reactions. You just take it on a daily basis, and that builds up blocking antibodies. And that's
cool.
It's safe, and it's really the Mercedes-Benz treatment of allergies. But most people don't really realize allergies cause a tremendous load on your immune system that will absolutely wear you out. And you ask anybody that has chronic allergies with chronic sinus infections and bronchitis and asthma, it's a debilitating problem. But that can be resolved naturally and safely with allergy immunotherapy with sublingual drops under the tongue.
Let me ask you this, Dr. Steve Hotze from Hotze Health and Wellness Center. What about food allergies?
Let me tell you, there's an old adage, one man's meat can be another man's poison. So what I might be able to eat with impunity, you might eat and make you deathly sick. Any food can cause a reaction. It can cause the same reactions as airborne allergens, and they work together concomitantly. But they can cause a host of GI problems, gut problems. They can cause chronic sinuses, chronic headaches. And the common foods are wheat, corn, egg, milk, yeast, soybean. Those are the common foods that commonly cause allergies because they're in all the processed foods. And what happens is you eat, if you have an allergic diathesis, in other words, a predisposition in your immune system, which is a genetically inherited trait, to have allergies, then as you consume these various foods, you're going to begin to react to those foods, and they're going to cause health problems. And you may think, gee, there must be something in the air, or I've got a cold,
right.
or I've got a bug. And it's the very foods you're eating. One man's meat can be another man's poison. So the wheat, the corn, the egg, the milk, the yeast, soybean. So what we do is we eliminate those foods you're allergic to for a period of time, maybe a month, and then you can add them back in and rotate them on a 4-day period so you don't have the allergy reaction. What you're doing is really getting the load off the camel's back, so to speak, or the donkey's back. So the and think of the immune system as the donkey or the camel that's carrying the load. Get the load off, and it can operate better.
Done. Dr. Steve Hotze. Do me a favor. You should visit every Monday.
I'd be glad to.
Doc, there's a million topics for us. Hotze Health and Wellness, right off of I-10, not far from where we are, just west of Beltway and I-10. Go visit Dr. Steve Hotze. I'll see you next Monday at 7:45.
Be back.
Thank you, sir.
Thank you so much for having us.
Sam Malone Show, AM 1070, The Answer.